Gentlemen, let's be honest for a moment. Once you reach your late 50s or 60s, things in the bedroom don't always operate the way they once did. Maybe you need more time to get started. Maybe firmness isn't what you remember. Or perhaps stamina just doesn't match your younger years. Sound familiar? You're far from alone. Countless men experience these age-related shifts. And here's the fact. It isn't just in your imagination. And it's definitely not something you must accept as an unavoidable part of getting older. Today, I want to share something straightforward, completely safe, and supported by solid science. A simple technique that requires only around 3 minutes daily, yet can create big improvements in erection strength, confidence, and even bladder control. No drugs, no procedures, no pricey gadgets. Just your own muscles and a bit of repetition. As a urologist, I've listened to thousands of men describe their frustration, embarrassment, and hopelessness. Many tell me, "Doc, I guess I'm just past my prime." My response is always the same. Aging happens to everyone, but decline does not have to follow. Your body can still adapt, recover, and strengthen if you target the right things. And the focus today is a deeply ignored muscle group in the male body, the pelvic floor. If that sounds confusing, don't worry. I'll break it down clearly. By the end of this video, you'll understand exactly how to train it, why it's crucial, and how strengthening it can naturally improve sexual function at any age. Let's begin with the basics. Why do changes occur as we grow older? Yes, testosterone influences sexual performance, but it's only one piece. Other factors such as heart health, blood pressure, diabetes, mental stress, and medication side effects can affect erections too. Blood vessels stiffen, nerves become less sharp, and circulation slows. But here's the part most men never hear. Even while all that is happening, you still possess a built-in support system, the pelvic floor muscles. Picture them as a hidden foundation. They support the bladder and bowels and are key to sexual performance. When they weaken, blood escapes faster, erections fade, and control decreases. When strong, they work like a natural clamp, helping blood stay trapped inside the penis for firmness and endurance. So no, this isn't just about size. It's about function. And building strength here is one of the most effective natural ways to restore capability. Step 1. Identify the correct muscles. Let's get practical. You first need to locate the proper muscle group. If you feel your thighs, abs, or glutes tightening, that's incorrect. Here's the simplest method. During urination, try pausing the flow halfway. That internal lift you feel? That's your pelvic floor activating. Another way. Imagine you're preventing gas from escaping. Same muscles. They stretch from the front pubic bone to your tailbone in the back. Once you recognize them, training becomes straightforward and soon feels instinctive. Step 2. A 3-minute daily routine. Now for the exciting part. This program is short, easy, and can be done almost anywhere. Sitting at your office chair? Perfect. Lying in bed? Works great. Even while driving and no one around will notice. Here's the simple layout. First, the slow hold. About 1 minute. Gently tighten your pelvic floor, lift it upward, and keep the contraction for 3 to 5 seconds. Then fully relax for the same duration. Perform 10 to 12 repetitions. This increases strength and steady endurance. Second, the quick contractions. Around 1 minute. Now move faster. Squeeze and release rapidly like flipping a light switch repeatedly. Do this continuously for 1 minute. These fast pulses train muscle reflexes needed to maintain erection firmness. Third, the long hold. Also roughly 1 minute. Contract again and maintain the squeeze for as long as you comfortably can while breathing normally. This enhances staying power and overall control. Comfortably can without pushing too hard. Maybe you'll start with about 10 seconds. Then slowly work your way up to 20 or even 30 seconds as time goes on. Relax afterward completely and repeat 3 or 4 times. That builds stamina and staying power. That's the whole routine. Just 3 minutes. No excuses. Now let's talk about why this actually helps. During an erection, blood fills the penis. But here's the important part. That blood must stay inside, otherwise firmness fades fast. The pelvic floor muscles behave like a clamp, squeezing the veins that usually let blood escape. When those muscles are stronger, They trap blood more effectively, giving you longer-lasting and firmer erections. This mechanism is called venous occlusion, and it's the core of erectile function. By building up these muscles, you're literally improving the physical mechanics behind your erections, and the bonus benefits go beyond sex. A well-trained pelvic floor enhances bladder control, decreases leakage, helps with premature ejaculation, and even supports recovery after prostate surgery. Before jumping in, let's review a few common mistakes. Don't push downward. The movement must feel like you're lifting internally, not bearing down. Don't stop breathing. Maintain normal breaths the entire time. Don't engage your abs, glutes, or thighs. If those muscles are firing, you're missing the correct area. Don't overtrain. In this case, more doesn't equal better. Stick with the 3-minute routine. Quality over quantity. And here's the secret ingredient: consistency. 3 minutes every day easily beats 30 minutes once a week. Even though pelvic floor exercises are powerful, they aren't the whole story. Your lifestyle counts too. Here are a few simple factors that make a big impact. Cardio exercise. Activities like brisk walking, cycling, or swimming boost blood flow everywhere, including where you want it most. Nutrition. Antioxidant-rich foods such as leafy greens, nuts, and berries support circulation. Try reducing heavy alcohol and sugary processed foods. Sleep. Poor sleep wrecks testosterone and performance. Aim for 7 to 8 hours stress control. High stress raises cortisol, which disrupts hormones and circulation. Try meditation, hobbies, or simple deep breathing. Medical checkups. Conditions like diabetes or high blood pressure directly affect erectile function, so don't ignore routine evaluations. When combined with pelvic floor training, these habits can dramatically change your life. Here's the best thing about this method. It doesn't need costly equipment, special privacy, or a big-time commitment. Just 3 minutes a day. You can squeeze it in while lying in bed, sitting at your desk, having coffee, or watching TV. Think of it the way you think of brushing your teeth. A tiny daily action that leads to major long-term benefits. Only instead of a brighter smile, you're gaining stronger erections, greater control, and boosted confidence. And I always remind my patients of this. Don't just do it for yourself. Do it for your partner too. Intimacy is a beautiful part of life, and it deserves attention and care. Men in your 50s, 60s, and beyond, don't fall for the myth that everything goes downhill. Your body still knows how to improve and adapt. Just 3 minutes a day can bring back control, confidence, and better erections. So here's your action plan. Practice this 3-minute pelvic floor routine every day for the next 4 weeks. Pair it with better sleep, healthier foods, and some light cardio. Watch the results show up not only in the bedroom, but in your energy and confidence throughout the day. If you found these tips useful, tap that like button, subscribe for future health advice, and leave a comment with your questions or results. I read every comment, and your support motivates me to make more content that helps men just like you. And stick around because in the next video, we'll be diving into prostate health, when screening matters, what to look out for, and how to protect your prostate long-term.